Dry eyes, you just squeeze on the lacrimal gland. What do you do?
You know, most of the time we just treat it with over-the-counter artificial teardrops. There is.
What name is some? Is it just artificial tears? What is it called?
Probably, there's a number of different brands. There's a Systane brand, there's a Blink brand, Refresh.
So you talk with your pharmacist and he gives you a tear replacement.
That's correct.
Now, if somebody has red eyes and their eyes are irritated, they go and they get dry eyes because sometimes they get a decongestant. Does that cause dry eyes?
It can. Some of the Visine type products that that says gets the red out, those aren't real great for the eye if it's dry. Visine makes an okay teardrop, but the gets the red out kind of product can sometimes actually make the dryness worse.
So if you've got dry eyes, what do you do about it?
Well, you know, dry eyes is one of those things, it's very underrated, okay? It can cause a lot of what we would call morbidity, a lot of problems with people's lives.
Like what?
Chronic pain, tearing. It can actually be so severe, it can cause people to be extremely depressed.
Scratch the cornea?
It can scratch the cornea, it can actually cause some corneal scarring, but it can really impact someone's life. Dry eyes also can cause a lot of blurred vision. Because if you think about it, the first thing that light hits when it goes in your eye is not your eye, it's your tear film. So if you don't have a good tear film, everything is fuzzed out. And so if you're having a lot of problems with vision that kind of comes and goes, gets blurry, you can blink a few times and it comes back, that's dry eyes.
What's the treatment for that from the ophthalmologist?
Probably my favorite thing to do are to put in what are called punctal plugs. Remember I mentioned that little tiny hole over here?
Yeah.
A lot of times we can put just a little plastic plug in there, just takes a few minutes. It's very safe, very easy. And I like the analogy of a bathtub, okay? And that little plug would be like the drain. And so when you put the plug in the bathtub, the water stays in the tub.
Yeah,
right?
Does it stay in the tub? Does it overflow on the tub if the faucet keeps going?
It does not, because remember you also have one of those little punctae, those little holes in the upper lid. So that actually does draw off some of the fluid. And a lot of times the punctal plugs can be helpful. There's also a prescription called Restasis that probably a lot of people have seen advertised for, and that can work for some folks also.